11 likely reasons why dogs pant. Dogs pant and breathe fast for a variety of reasons. Though, not all panting is abnormal. Moderate to rapid open-mouthed respiration is a normal dog and puppy behavior that lowers their body temperature and also gets oxygen into the dog's bloodstream. The panting dog breathes with its mouth open and tongue somewhat protruding. Panting should not be confused with labored breathing. While labored breathing is characterized by strained respiration and may be accompanied by sounds of distress like crying or whining, or whistles from the nostrils or windpipe due to blockage. If your dog is playing hard with you or other pets in your home, it wouldn't be that alarming to see them panting. After all, we breathe faster when we are active. Dogs that are having difficulty breathing may be stretching their neck out. They may be holding their elbows away from their body to allow their chest to rise and fall more, and you may also see something called an abdominal component to their breathing. These are a few common reasons why dogs pant. 1. To cool off. Panting as a cooling mechanism is necessary because dogs do not have an effective system of sweat glands like people do. Instead, dogs cool their bodies using the evaporation of moisture from the mouth and tongue, and by exchanging the hot air of their lungs with cooler external air. Panting allows dogs to release heat and exchange it for cooler air. As you may imagine, this is not a very efficient process. It's even less efficient for short-faced dogs, like bulldogs or pugs. That's why dogs start to pant even when they get even a little bit warm. The hotter a dog becomes, the more intense the panting becomes. Sometimes, heavy panting is accompanied by drooling and redness of the tongue and gums. Along with profound panting, warning signs of overheating include the bright red tongue and gums, wide eyes, and weakness. Even if they are not overheating, dogs will pant from exercise. It's much like the way humans breathe heavily when doing aerobic exercise. However, panting is also the primary way for dogs to cool themselves off because they don't sweat the way humans do. Though dogs do sweat a little bit from their paw pads, this cannot sufficiently cool them off. Instead, dogs cool themselves through their mouths. 2. Reverse sneezing. This is breathing that is associated with the stereotypical honking sound. It's not usually an emergency and is common in smaller breed dogs, such as Shih Tzus, Yorkshire Terriers, and Pugs. Although it can sound frightening, reverse sneezing is usually short-lived and either is derived from inhaling an irritant or just being excited about something. 3. Excitement, stress or anxiety. Panting may have nothing to do with body temperature. Many dogs will pant when they experience fear, anxiety, or stress. Examples include car rides, fireworks, separation anxiety, vet visits, and other stressful events. Look at your dog's body language to help you determine if your dog is showing signs of fear or any other type of distress. Understanding the cause of fear or anxiety in your dog can help you minimize these incidents. If panting seems to be related to fear, anxiety, or stress, it's best to remove your dog from the situation as soon as you can. 4. Heat stroke. Since dogs pant to regulate their body temperature, if a dog has a fever, they will pant to try to cool off. Dogs that are susceptible to heat stroke, including English bulldogs, will start to pant heavily if they become hypothermic in an effort to try and cool off. 5. Pain or discomfort. Dogs are pretty good at hiding pain and illness from humans. Some dogs try harder than others to hide their discomfort. However, once they reach a certain level of discomfort, they often cannot help but show signs, such as panting. Look for other signs of illness or pain, such as vomiting, loss of appetite, diarrhea, lethargy, limping, pacing, and behavior changes. Contact your veterinarian if you suspect that your dog is sick or injured. 6. Tracheal collapse. Certain small breed dogs, such as Chihuahuas, Yorkshire Terriers, and toy poodles are prone to a condition known as tracheal collapse. This is a condition in which the trachea, or airway, narrows to an impossibly small diameter. This can limit the dog's ability to inspire air and can cause an increase in respiratory effort. 7. Physical problems. Dogs with a high fever may pant to help lower their body temperature. Medications given by the veterinarian may increase respiration or prompt panting. A very full stomach or bloat may also cause your dog to pant, sometimes in preparation for vomiting. This can be an emergency and your pet should be evaluated immediately if they are vomiting or dry heaving. Cushing's disease, a condition caused by excessive production of the stress hormone, cortisol, can cause excessive panting. 8. Heart failure. Dogs that are in heart failure can have a rapid respiratory rate and an increased respiratory effort. When a dog is in heart failure, its heart cannot adequately pump blood out to the lungs and the body. When this happens, the blood can get backed up into the blood vessels in the lungs. This can put pressure on the lungs themselves, preventing them from inflating all the way, and a dog will breathe faster to compensate for this. 9. Play. Panting may simply be a sign of happiness in your dog. If so, the rest of your dog's body language will reflect this happy mood. The tail will usually be wagging in a happy way. Your dog's body and facial features will be somewhat relaxed. The eyes will appear bright and happy. Once things calm down, the panting will slow down and eventually stop. Continued mild panting with an open mouth and bright eyes is normal in a relaxed, content dog. In fact, many people consider this to be a doggy smile. 10. Brachycephalic airway syndrome. As the name implies, this is something that affects brachycephalic dogs, such as French bulldogs, pugs, and other dogs with pushed-in faces. As the word syndrome implies, brachycephalic airway syndrome, sometimes just called BOAS, is not just one issue with the dog's airway but multiple. This can be stenotic nares, everted laryngeal saccules, an elongated soft palate, and other anatomical abnormalities. All of these by themselves can make a dog predisposed to respiratory difficulty, but dogs with BOAS are especially prone to heavy and fast breathing because of their anatomy. 11. Metabolic acidosis. Most commonly caused by kidney disease or diabetic ketoacidosis, this is when a dog's body isn't able to maintain a normal pH. As their pH drops, they start to pant more. By doing so they are expelling more carbon dioxide, which is one way for the body to raise its pH. What to do if your dog is panting? If the cause is immediately understood, such as play or anxiety, intervention is not needed. Offer water if they've been playing and may be hot, but if the cause is unclear or worrisome, such as from a physical problem, bring them to the vet to get checked out. Treatment prevention for dog panting. If your dog is in respiratory distress, if they are having difficulty breathing, or if their gum and tongue color is changing to a dusky gray or blue, veterinary medical attention should be sought immediately. Though, treatment will depend on the cause of the panting, but if it's due to heat, offer water or run the AC to help cool them down quicker. You can also drop a wet towel over them and placing a fan in front of them. Your dog may also be given a low dose of a sedative to help calm them down. Being in respiratory distress is stressful to begin with, so the added stress of not being able to breathe well can further stress a dog out and can contribute to increased respiratory effort. Sedation can help diminish this added stress component. If your dog is in respiratory distress due to fluid buildup in or around their lungs, they may also benefit from a diuretic such as furosemide to help pull this fluid off the lung space,